Balance does not just gradually fade like vision or hearing fades, it collapses. Not always in a dramatic single event, though a fall can certainly be that, but in a series of small retreats that happen so quietly and so gradually that by the time the person notices them, the retreat has already become significant. You start holding the wall when you step out of the shower. You pause at the top of stairs before descending. You reach for the back of a chair before lowering yourself into it. You stop walking on uneven ground without thinking about it consciously, because something instinctive has already decided the ground is a risk. And none of this feels like a crisis. Each small adjustment feels like wisdom, like the natural accumulation of appropriate caution that comes with decades of experience. But underneath the wisdom is a physiological reality that most people do not understand, and that the standard advice about staying active and going for daily walks does not fully address. Because walking, while it provides important general health benefits, does not provide the specific neurological training that a failing balance system requires. And the exercise that does provide that training, the one backed by a specific and growing body of research showing balance improvements that outpace what walking alone produces, is not what most people expect when they hear the phrase balance exercise. 1 in 3 adults over 65 falls in any given year. 1 in 2 adults over 80. Falls are the leading cause of injury-related death in people over 65 in the United States. They are the leading cause of hip fractures, traumatic brain injury, and the loss of independence that transforms the quality of a life more completely than almost any other single event in aging. But here's the piece of the fall statistics that most people never hear. The majority of falls in older adults do not happen because of slippery surfaces or poor footwear or unexpected obstacles. They happen because the balance system that should have detected and corrected the perturbation was not fast enough, not accurate enough, or not strong enough to prevent the loss of center of gravity before the fall was already in progress. The surface was fine. The shoes were fine. The environment was manageable. What was not sufficient was the speed and precision of the neuromuscular response that should have kept the body upright. And that response can be trained. Specifically, deliberately, with a kind of targeted effectiveness that walking, for all its genuine virtues, simply does not provide. This is Dr. Victor Lang, and the conversation we are about to have about balance training, specifically the exercise that research consistently shows produces faster and more measurable balance improvement than walking, may be one of the most practically important things this channel has offered. If you want access to this specific kind of information, hit like and subscribe right now, because what follows is the explanation and the practice that changes what falling means to the next years of your life. Let us start with the neuroscience of balance, because understanding why it declines and what actually restores it is the foundation without which no exercise instruction makes full sense. Balance in the human body is governed by 3 simultaneous sensory systems that must work together in real time to maintain the body's center of gravity within its base of support. The vestibular system in the inner ear detects angular and linear acceleration of the head, providing information about head position and movement in space. The proprioceptive system, distributed through the muscles, tendons, and joints throughout the body, detects the position and movement of every body part relative to the others and relative to the ground. And the visual system supplements and cross-checks the inputs from the other two, helping the brain construct its real-time map of where the body is in space. Balance is the continuous, unconscious process of the cerebellum and other brain regions integrating these 3 streams of sensory information and sending corrective motor commands to the muscles that maintain postural stability, all in milliseconds, continuously, with every slight shift and sway that occurs even during standing still. When any of these 3 systems declines, which all 3 do with age, the balance system's ability to respond quickly and accurately to postural disturbances is reduced. The vestibular sensory hair cells of the inner ear diminish in number and function across the decades, reducing the precision of vestibular input. Proprioceptive signal quality decreases as the sensory nerve fibers and mechanoreceptors in the joints, muscles, and the skin of the feet lose their density and their signal speed. Visual acuity declines, and the central nervous system processing speed that integrates these 3 streams and generates the corrective motor command slows in the ways that characterize neural aging generally. The result is a balance system that is working with lower quality, slower arriving sensory inputs, and that generates motor corrections that are slightly less precise and slightly slower to arrive than they were at 40. In most situations, this reduced performance is not visible. The person walks without incident, descends stairs without incident, performs the activities of daily life without incident. But the margin has narrowed. The system that used to have considerable reserve to absorb an unexpected perturbation is now operating closer to its functional edge. And when a perturbation arrives, a slight trip, an unexpected surface change, a misjudged step, the margin that was always there is no longer there, and the fall happens. The exercise that specifically addresses this deterioration at its neurological root, and that the research on fall prevention has consistently elevated above walking as a balance rehabilitation tool, is Tai Chi. Not Tai Chi as a gentle stretching practice or a calming movement meditation, though it is both of those things as well. Tai Chi is a specific, deliberate, evidence-based neurological training protocol that challenges the balance system in exactly the ways that force it to adapt and improve, and that does so through a movement structure that is specifically suited to the capabilities and the risk profile of older adults in ways that other balance training modalities are not. The research base for Tai Chi and fall prevention in older adults is among the most robust in all of exercise science for a single intervention. A landmark meta-analysis published in the journal JAMA Internal Medicine, examining 9 randomized controlled trials on Tai Chi and fall prevention in community-dwelling older adults, found that Tai Chi practice significantly reduced both the rate of falls and the number of people who fell, with the risk reduction reaching 40 to 55% in some of the individual trials. A subsequent systematic review and meta-analysis in the British Journal of Sports Medicine, examining 49 trials and over 14,000 participants, found that Tai Chi reduced falls by 21%, with greater reductions in higher dose programs, and that the balance-specific improvements were observable after as little as 8 to 12 weeks of regular practice. These are not modest effect sizes. A 21 to 55% reduction in fall risk from a movement practice done for 30 to 60 minutes, 3 to 5 times per week, represents one of the most powerful protective interventions available to any older adult who is concerned about falling, and it is substantially more effective than walking alone at the specific task of improving the neuromuscular balance response. The reason Tai Chi produces these effects more powerfully than walking comes down to the nature of the challenge it imposes on the balance system. Walking, as a bilateral, rhythmic, forward-directed movement performed on familiar surfaces, provides relatively limited challenge to the proprioceptive and vestibular systems once the basic skill is mastered. The brain, which has been walking since early childhood, performs walking with minimal higher-level balance processing, because the movement is so well practiced that it is largely automated. The balance systems are engaged during walking, but not in the specific way that produces meaningful adaptation and improvement in people who already have adequate walking skill. Tai Chi, by contrast, imposes a continuous series of novel balance challenges through its slowly moving, weight-shifting, single-leg support movements that place the body in positions that require active, conscious proprioceptive processing rather than automated movement execution. The slow speed of Tai Chi movements is specifically significant because moving slowly through transitions between postures requires the postural muscles to sustain isometric and eccentric loads that rapid movement never demands, training the ankle, knee, and hip stabilizers in exactly the positions and time domains where postural corrections during a near fall must be made. The unilateral weight bearing that is inherent in almost every Tai Chi form, the periods of standing on one leg or shifting fully to one side, trains single-leg balance in ways that walking, which never requires sustained single-leg stance, simply does not provide. The vestibular system benefits of Tai Chi come from the head rotations and gaze-changing movements that are integrated into many of the traditional forms, and that provide calibration challenges to the vestibulo-ocular reflex, the neural coupling between head movement and compensatory eye movement that stabilizes vision during motion. This reflex declines with age in ways that contribute to the disorientation and instability that older adults sometimes feel during head movements. And specific vestibular challenge movements within Tai Chi practice provide the repeated stimulus that helps maintain the calibration of this reflex. The psychological dimension of Tai Chi's effect on fall prevention is one that deserves specific attention because it is as well documented and as practically important as the physical mechanisms. Fear of falling is one of the most powerful and most underappreciated contributors to the progressive restriction of activity that accelerates balance decline in older adults. Research shows that fear of falling is present in a majority of older adults who have experienced a fall and in a significant proportion who have not, and that this fear leads to activity restriction that reduces the very physical activity and balance challenge that would maintain and improve the balance system. The reduced activity leads to muscle weakness and reduced proprioceptive loading, which worsens the balance deficit, which increases the legitimate grounds for fear, which produces further restriction in a descending cycle that the clinical literature calls the fear-fall spiral. Tai Chi has been specifically shown in controlled research to reduce fear of falling as a measurable psychological outcome, alongside its physical fall risk reduction, with the proposed mechanism involving the gradual building of movement confidence through successful navigation of balance challenges in a controlled, intentional setting. The person who practices Tai Chi regularly becomes incrementally more confident in their ability to manage their body and space because they have been practicing managing their body and space deliberately and successfully for weeks and months. That confidence is not false. It is grounded in the genuine neurological and muscular improvements that the practice has produced. For people who are entirely new to Tai Chi and who are concerned about their current balance being insufficient to begin, the entry point to safe practice is the seated and simplified version of Tai Chi movements, which have been specifically developed for people with significant balance impairment and which produce balance improvements even in people who cannot safely perform the standing forms. Several major research institutions, including the Mayo Clinic and the National Institute on Aging, have developed simplified Tai Chi protocols specifically for fall prevention purposes in older adults, with and without assistive device use. And these simplified versions have been shown in their own clinical trials to produce meaningful fall risk reduction, while being accessible to people across a wide range of initial physical capacity. For people with some existing balance capacity who are ready to begin a standing practice, the most critical element is beginning with the stable support available, such as a sturdy chair or countertop, during the first weeks of practice until the basic weight shifting patterns become familiar. The goal in those early weeks is not to challenge the balance system maximally, but to learn the fundamental movement vocabulary of the forms being practiced, so that the balance challenge can be gradually increased from a foundation of movement familiarity rather than being introduced simultaneously with unfamiliar movement patterns. Supervised instruction from a qualified Tai Chi teacher who has experience working with older adults significantly accelerates both the safety and the effectiveness of the learning curve, and many community centers, senior centers, and YMCAs now offer group Tai Chi classes specifically designed for fall prevention in older adults. Research comparing home practice to group instruction consistently shows faster improvement in the group instruction setting, attributed both to the quality of technique feedback and to the social engagement that group practice provides, which has its own documented effects on adherence and on psychological well-being. The research on what makes Tai Chi practice most effective for balance improvement points to several consistent factors. Practice frequency of at least 3 sessions per week, with 5 preferred, produces substantially better outcomes than 1 or 2 sessions per week. Session duration of at least 30 to 45 minutes allows sufficient balance challenge and repetition within each practice. The specific style of Tai Chi used matters less than the commitment to regular practice, though forms that incorporate more single-leg balance components and more weight-shifting movement produce somewhat stronger balance-specific outcomes than purely slow, symmetrical forms. And the continuity of practice, meaning maintaining a regular practice over months and years rather than stopping after an initial improvement, is what preserves the gains and continues to build on them, because balance decline is a continuing process and the training that counters it must be equally continuous. There is something I want you to sit with for a moment before we finish, and it has nothing to do with exercise technique. It has to do with what falls mean, not in the medical statistics sense of how many people fall and what the injury rates are. In the personal, human sense of what a fall changes. A fall changes the way a person enters a room, the way they approach a staircase, the way they think about a sidewalk with an uneven surface. A fall changes the way other people see them and the way they see themselves. A fall begins a conversation about what accommodations might be necessary, what activities might no longer be safe, what independence might need to be negotiated away. Most falls could be prevented. The balance system that was going to fail when the perturbation came could have been better, faster, and more precise. It could have caught the near miss instead of converting it to a fall, and the specific evidence-supported practice that would have made it better was available. It was always available. It just had to be found and started. You have found it. The starting is what remains. Tell me in the comments whether you have tried Tai Chi before or whether balance has been something you have been quietly worried about and not known what to do about. Tell me whether there is a Tai Chi class near you or whether you have been using a video. Your experience matters to the people in this community who are in the same place you were before watching this, looking for the specific answer that actually addresses the problem. Please share this video with everyone in your life over 65 who walks regularly for their health and who does not know that walking, for all its benefits, is not specifically targeting the neurological system that determines whether they fall or do not fall when the moment arrives unexpectedly, because that information may be the most important exercise update they receive all year. The body has not lost the ability to become more stable. It has only been waiting for the specific challenge that tells the balance system what to rebuild. Give it the challenge. Give it Tai Chi. Give it the time it needs to respond. What you practice is what you keep. Start practicing balance before you have to recover from losing it.